IUDs and implants are so-called get it and forget it methods of birth control. And the reason they're called that is because they last for a really long time, up to years, and they don't really require much maintenance. Let's start with implants. So the trade name of implants are called Nexplanon, and what they are small plastic rods that contain a hormone called progestin, and they're inserted just under the skin of the upper arm. So here's a little picture to just show you that it goes right there in the upper inner arm where it's protected from getting bumped or really being noticed by anyone. So what does this actually look like? Well, I have this, and I have measuring tape so we can see just how big it is. So this is sort of supposed to be a simulation of your arm, and then this is a model implant. So you can see that it's just kind of about the length of my pen cap. Or about 1.5 inches long. So the implant provides contraception for up to 3 whole years. And the way that it works is that the hormone that's in it prevents ovulation, which is the release of an egg, and it thickens the mucus in the cervix, which blocks sperm from swimming into the uterus. Implants provide effective birth control as early as 1 week after having them placed, and they don't change your fertility after you have them removed. And they're about equal to sterilization in terms of efficacy. The most common thing people complain about with their implant is irregular bleeding, but usually that will taper off after a couple months. And there's always minor risks in placing the device. Anytime you break the skin, there's a risk of infection. Now let's talk about intrauterine devices, or IUDs. There are 2 kinds of IUDs. There's the Mirena IUD, which prevents pregnancy by using progestin hormone. And there's the Paragard, which uses copper to prevent pregnancy. Mirena is good for 5 years, and Paragard is good for 10 years. This is an example of a Mirena IUD, and the Paragard IUD looks pretty similar. So as you can see, it's only about just over 1 inch long. And so it's not very big, and this is the actual size, and again you can see my pen cap for comparison. It's just about that big. And so if this is an example of a uterus, a doctor will take a little tool that looks like this and use that to insert this into the uterus. Okay, and again, just as another example, I drew another example of a uterus. Your IUD will just go right in through the cervix, and then it'll sit right here. And it'll just sit there. So once again, Mirena works by using progestin hormone to prevent the release of an egg, and also to build up mucus in the cervix, which blocks sperm from being able to swim into the uterus. Mirenas can be left in place for up to 5 years, and they have a really low failure rate compared to a lot of other methods of contraception. The risk that you should know about with Mirena or any IUD is that they can poke through the uterus or come out without you noticing, but that's pretty rare. Other people complain of irregular periods, but a lot of times periods stop completely. So Paragard's the copper-containing IUD, and it's thought that the copper is toxic to sperm. So it can be a good option for women who don't want to use hormones or are unable to use hormones, and it can actually also be used as emergency contraception. Some women complain of crampier periods with the Paragard, and it also has some of the same risks as Mirena does, and it has a pretty low failure rate. And once again, just to summarize, here's a side-by-side comparison of our two types of IUDs, the Mirena and the Paragard. You can click the link to cdc.gov for more information. The benefits of both types of IUDs is that they last for years at a time, they don't require a lot of maintenance, and they don't change your fertility when you have them removed. I already talked about some of these risks, but the one thing I should add is that they may not be recommended if you have a history of sexually transmitted infections. I would encourage you to talk to your doctor for more information if you're interested in any of these types of contraception or even other types of contraception. Everyone is different, and you want to find out what's going to be the most safe and effective choice for you. For more information on all types of contraceptives, you can try cdc.gov.